BBL using ultrasound technology to maintain safety of the BBL. And as you can see in this patient, her buttocks to her waist and projection is flat, and by augmenting it with fat, we can really improve her figure. And we're doing this using ultrasound. We use a Sonosite M Turbo with a shallow probe. This probe allows us to see up to 3.1 millimeters, 3.1 centimeters, and that's enough for me to be able to assess where the position of the tip of this cannula is. And I want to be in the black portion. And if you look at the window over there, you can see where my probe is. And I'm in the black area, and that's the tip, if you see it. And it's a little bit hard on image and there's several layers. The deep striated one is the muscle. We don't want to be in that, certainly. And the superficial, the dark one is the fat, and we want to be in the fat. We want to add fat to a layer that is fat. And then there's a additional layer that is the fascia, and we want to be above the fascia. Right there, the white is where our probe is.
Careful, liquid. It's not liquid.
Today we're doing vaser liposuction of upper, middle, lower back, Renuvion skin tightening on this lovely lady who's 46 years old, mother of one, who came to me because she was concerned about her overall body. When we initially evaluated her, she was heavier, so we asked her to lose some weight. She lost around 40 pounds before the operation by diet and exercise, and then she came to us, and our plan of care for her included liposuction, skin tightening because she had some extra rolls and tissues in the back in these areas, and then fat grafting, taking that fat and putting it in her buttocks. We put around 1000 cc in each hip and buttocks area for her to give her a nice contour that she was desiring. Then we're going to flip her, and we're going to do a full tummy tuck for her to allow her to have nice abdominal contour that is flat and nice curvature at her waist. We're doing a tummy tuck on this lovely lady who came here all the way from Tennessee to have her surgery done, and we did an examination preoperatively to check to make sure there is no hernia, and preoperatively we didn't feel any type of hernia. She was a little bit heavier. Sometimes we order a CT scan preoperatively on patients that are heavier, but because she was traveling from Tennessee, it was hard to order a CT scan and have her come over here. So now that we are in the OR and we have raised the flap in this area, we got to this region, and you can see how this area, there is a defect the size of the tip of my finger that goes in and is causes the content of the bowel, omental content of inside the peritoneal cavity to come out in this area. So we have to fix this in support of her surgery to make sure that when we tighten and plicate, this doesn't cause a bulge in this area of the content of inside the abdomen. We've just completed liposuction using vaser of upper, middle, lower back, liposuction of the arms, Renuvion of all these areas, and then BBL, which is fat grafting using ultrasound, and then flip and did a full tummy tuck on this lovely lady. You can see a beautiful definition. You can see nice curvature over here on this lovely lady. Thank you for joining us.